In this video, we will explore the important topic of masking and camouflaging in girls with Autism Spectrum Disorder, ASD. Masking and camouflaging are strategies individuals with ASD employ to hide or mimic their autistic traits in social situations. Recognizing when girls with ASD are masking or camouflaging is crucial for understanding their unique needs and providing appropriate support. In this video, we'll explore indicators and techniques that can help you identify when girls with ASD are engaging in these behaviors. Indicators of masking and camouflaging. Social chameleoning. Girls with ASD may display a strong desire to fit in socially. They may observe their neurotypical peers closely and imitate their speech patterns, mannerisms, interests, and even clothing choices. They strive to blend in and mask their true autistic traits, making it challenging to identify their underlying social difficulties. Compensatory strategies. Girls with ASD often develop compensatory strategies to mask their social challenges. They may memorize social scripts or rely on specific phrases and responses to navigate social interactions. These strategies help them appear socially competent while concealing their struggles with communication and social understanding. Contextual differences. Girls with ASD may exhibit different behavior and communication styles in various contexts. They may demonstrate stronger masking tendencies in public or unfamiliar settings, where the pressure to conform is higher. In more comfortable environments, such as at home or with close family members, they may display more authentic autistic traits. Exhaustion and social withdrawal. Engaging in masking and camouflaging requires immense effort and energy. Girls with ASD may experience social exhaustion or fatigue from continuously suppressing their natural autistic traits to fit in. As a result, they may withdraw from social interactions, exhibit increased anxiety, or prefer solitary activities to recharge. Cognitive overload. Masking and camouflaging can lead to cognitive overload for girls with ASD. Trying to process social cues, adhere to social expectations, and suppress their natural autistic tendencies simultaneously can be overwhelming. This overload may manifest as increased anxiety, reduced focus, or difficulties with cognitive flexibility. Techniques for recognizing masking and camouflaging. Observe social interactions. Pay close attention to how girls with ASD interact in social settings. Look for inconsistencies between their behavior and their underlying social communication difficulties. Notice if they excessively mimic or mirror the behaviors of others, or if their responses seem rehearsed or scripted rather than spontaneous. Analyze communication patterns. Examine the content and style of their communication. Girls with ASD who are masking or camouflaging may use language and expressions that seem advanced or imitated from their peers. However, their comprehension and nuanced understanding of social cues may be limited. Look for inconsistencies between their expressive language skills and their receptive understanding. Identify sensory sensitivities. Girls with ASD may mask their sensory sensitivities to avoid drawing attention to themselves. They may develop coping mechanisms to manage sensory overload in social situations, such as subtle self-soothing gestures or avoiding certain environments. Pay attention to any signs of discomfort or strategies they employ to regulate their sensory experiences. Notice social fatigue and withdrawal patterns. Monitor their social engagement and energy levels. Girls with ASD who are masking or camouflaging may experience social exhaustion or fatigue more frequently. They may demonstrate withdrawal from social interactions, exhibit increased irritability, or show a preference for solitary activities. Seek insights from multiple sources. Collaborate with parents, teachers, therapists, and other professionals involved in the girl's life. Gather comprehensive information about her behavior and social interactions across different contexts. By collecting diverse perspectives, you can gain a more accurate understanding of her masking and camouflaging tendencies. Understanding when girls with Autism Spectrum Disorder are masking or camouflaging is essential for providing them with appropriate support and accommodations. By recognizing the signs of masking and employing specific techniques, we can create a more inclusive environment where their unique needs are understood and valued. Remember, each individual with ASD is different, and masking behaviors can vary greatly. With increased awareness and a compassionate approach, we can ensure that girls with ASD receive the understanding and support they deserve to thrive authentically.